So in the upper limb dissection, today we will see the dissection of the pectoral region. In this, first we will see the various landmarks, and then according to the landmarks we will put the incisions and see the four main structures, that is the pectoralis major, pectoralis minor muscles, and medial and the lateral pectoral nerves. So here you can see that the incisions is already given here. So first landmark here, this is your center of the suprasternal notch here, and here somewhere you have the tip of the xiphoid process. Now vertical incision connecting this suprasternal notch with the tip of the xiphoid process, you have to put first incision like this. Second incision, that is horizontal, extending from the xiphoid process up to the posterior axillary fold. Third incision, that is parallel to the clavicle up to the lateral end of the clavicle. And fourth incision, that is in an oblique fashion, extending from xiphoid process to the peripheral aspect of the areola, and then it is extending up to the anterior axillary fold. After putting the incisions, we have to reflect the flap of the skin laterally. So in the next slide you will see the reflected part of the skin laterally. Now here you can see the deep fascia, that is the pectoral fascia, whitish in color, and this is the superficial fascia here, yellow in color, attached with the reflected part of the skin. And this muscle is the pectoralis major muscle here, which is having the two heads originating from the medial 2/3 of the anterior aspect of the clavicle, that is the clavicular head, and from the manubrium and body of the sternum up to the 6th costal cartilage onto the lateral part of the manubrium and sternum up to the 6th costal cartilage, that is the sternocostal head. It is also originated from the 2nd to 6th costal cartilage as well. And this muscle, pectoralis major, is going to insert onto the lateral lip of the bicipital groove in a U-shaped bilaminar tendon. After that, we are going to reflect the pectoralis major muscle laterally by cutting the clavicular and the sternocostal head. So we have already put an incision here and cut the pectoralis major muscle from its clavicular and the sternocostal heads. After reflecting, you can see this is your reflected pectoralis major muscle. Below to that, here you can see this muscle. It is a pectoralis minor muscle, which is originating from the 3, 4 and 5th costochondral junction, and it is inserted here, going deep from this area and inserted into the tip of the coracoid process, particularly the medial and the upper aspect of the coracoid process. Now we will see the two nerves, medial pectoral nerve and the lateral pectoral nerve, which are the branches from the lateral cord of the brachial plexus. So here you can see this nerves between the forceps, just above the forceps. This is the lateral pectoral nerve, which is going to pierce the clavipectoral fascia, and that is going to supply the pectoralis major. This is the pectoralis major muscle here, So that is entering from the deep aspect of the pectoralis major muscle after piercing the clavipectoral fascia. This is the lateral pectoral now. Now we will see the medial pectoral now. So here you can see this is the outline of the pectoralis minor muscle, and this is your pectoralis major muscle here. This is the lateral pectoral now here, and one now that is piercing this pectoralis minor muscle here and coming out and also supplying the pectoralis major muscle. That is the medial pectoral now. So that's all about the pectoralis major, minor, and the medial and the lateral pectoral nerves. Thanks a lot.